of how to set up your PA catheter, so that you could also shoot cardiac outputs. Firstly, you're going to use this MAC introducer to place to put in the CVP, and through which you're going to place the PA catheter. I do highly recommend that you use a device like this, a compass, to verify that you're in the venous system. And what you do with this compass is you connect this end here to first you get access, you disconnect your syringe from your needle, and you put this on the other end of where your syringe was. You turn this on before you, in fact, before you connect it, you turn this on and you make sure it says 0. Then you connect it and you read the number and you make sure it's a venous pressure. If this number is anything, it gives you mean pressure. So if it's something that could possibly be a mean pressure, be very concerned that it's arterial. Obviously, this particular patient that we're talking about and some others may have high CVPs, but they shouldn't have CVPs in the 30 to 40 range and higher. So anyhow, that's the compass. Then you're going to put in this catheter here. Your PA catheter is going to go through this port here, and you have 2 extra ports that you can use for placement of your IV fluids and drugs, etc. Then you are going to get ready to put your PA catheter in, and before placing your PA catheter, you're going to have the technician check the balloon by inflating the balloon and making sure it goes up and stays up. In addition, you're going to flush each lumen. So this is an infusion lumen, which I must say may not have to be connected to anything, because you might have a lot of infusion ports and might not need it. So you could put a stopcock here and close it once you've flushed it. Your CVP, CVP connector is port is going to be connected to something that looks like this. So that this is going to connect over here, and your pressure cable, your transducer, which is going to be here, just an ordinary regular transducer, which connects to your 3 transducers. You're going to take the CVP line and you're going to connect it in here, and you're going to flush the line. Blood should then come out of your proximal port, which is at about, which is right over here, in fact, at 30, the 3 lines. Then what you're going to do is you're going to connect the PA connector, which is going to be connected to your triple transducer, and you're going to connect it here, and you're going to flush it, and it's going to come right out through your distal port. Okay? So now you have your PA catheter ready to go, and you're going to place it, watching waveforms go in as you're placing it. Once you want to shoot cardiac outputs, and please remember, cardiac outputs are not going to be accurate in the setting of intracardiac shunts or severe tricuspid insufficiency, which is probably going to be the case in the patient that we're planning to put it in, who's having the liver transplant. So the catheter at that point will mostly be very helpful to measure PA pressures, to measure CVP, and to give you mixed venous oxygen saturations, which will be a reasonably accurate measure of cardiac output. But if you do want to shoot cardiac outputs, and certainly in other patients, you'll connect this transducer to this box here that says cardiac output, and it should then be automatically turned on, which it is there. Then what you're going to do is, this isn't connected yet, so we'll disconnect it. That's how it comes. You will connect this end to here, and it's sort of a lower lock connection. And then this thing here, which is connected to your proximal port, is where you're going to inject your cardiac outputs. While this is off to the cardiac output, and it's going to be reading the patient's CVP. But if you are getting ready to shoot cardiac outputs, Your IV here, which connects to this end, is going to be connected to a 100 or 250 cc bag of normal saline. In this particular case, I recommend a 100 cc bag of normal saline because you're probably not going to shoot too many cardiac outputs. So there's going to be a bag of saline here, all aired, all run through, and it's going to be in an ice bath. And you could just put it in the ice bath like this. It doesn't matter if there's air in it, although you should run it through. And the reason why I'm saying that is because you're not going to inject until, you're going to draw up fluid from the bag here, and you're going to make sure there's no air in it before you inject, for sure. But this could be in a bag at a level, it doesn't have to be above the patient's heart or hung up on an IV pole. It really can't be, because it has to be in the ice bath. This then is going to be in whatever ice bath, in wherever the ice bath, the temperature of the ice bath, because what essentially this is doing is it's measuring the temperature of the injectate. Okay, so now you're going to be ready to shoot cardiac outputs. What you're going to do is on this thing, on the cardiac output thing, there's something that says setup, and just to make sure that that this particular thing shows up.